Hello, I'm Henry Acosta for Health Professional Radio. On the show today with us is Dr. Michelle Celander. Dr. Michelle is the director and a program and content creator at Weight Watchers International. She is responsible for ensuring the integrity of the Weight Watchers program and the accuracy of all content created from the brand. Today, we're here to talk about a new study that has shown the community based weight management program with Weight Watcher helps people lose more weight than those who received intervention and self help materials. Hi, Michelle. Thanks for coming on the show and welcome.
Thanks so much, Henry. It's a pleasure to be here.
Can you tell us a little bit more about yourself before we get started?
Yeah, I'd love to. So I'm a qualified dietitian and a doctorate level research scientist. I work here at Weight Watchers with a team of nutritionists who really oversee everything related to the Weight Watchers program and ensure both the integrity and accuracy of everything that we create to help our members on their weight management journey. I've been working in different roles through my career, for example, in clinical dietetics and university lecturing, health communications, nutrition research, and what I really love to do is turn credible science into compelling communications that really helps people to improve their health.
I see, and yeah, I like the work that you're doing, and thanks for doing this kind of work.
No, it's actually really, it's a lot of fun and very fulfilling. So
Yeah.
I feel very grateful to work in the type of job that I do.
With regards to the study that I just mentioned, can you tell us a little bit more about it? Some details that goes along with the research?
Yeah, absolutely. So the study was just published in the Lancet, and it does show once again that Weight Watchers is clinically effective. And in this particular trial, GPs, so it was conducted by academics in the UK and included 23 different GP clinics. It was a study that was run over 2 years and included a really large sample of 1,267 people. And the participants were randomised into one of three groups, either what we call the do-it-yourself approach, so essentially given a self-help material and then people went on their way, and compared that to the 3-month Weight Watchers program and the 12-month Weight Watchers program. And what the research found is that people who were on the Weight Watchers program for 12 months actually lost twice the amount of weight as those who were on the do-it-yourself self-help type approach. And what was really interesting is not only did they have better weight loss after the year of being in the program, but they also were able to sustain that weight loss over time. We saw that their health markers improved, so things like their glucose and HbA1c levels improved. So not only are we seeing those benefits in terms of superior weight loss with the type of approach that we have in managing weight, but also improved health in potentially reducing long-term risk to things like diabetes. So it's a really fantastic study that demonstrates once again that there is great potential in the approach of collaboration between health professionals and commercial organisations like ours, which are fully based on evidence-based approaches.
Yeah, and it sounds like great news for everyone who's trying to lose weight. And what does this mean for people who have issues with their weight, and or what kind of impact does it have with the community?
Yeah, well, we know in Australia that about 2/3 of us are overweight and obese. So really, this type of research can be helpful to anyone who's not in the healthy weight range. And I guess with rising obesity prevalence and all of the burden of disease, quality of life compromises, and of course any stress on the healthcare system, what this does is brings to life a potentially innovative way for us to think about weight management solutions that are evidence-based, scalable, so able to reach all members of the Australian community, sustainable, so not just a one-hit wonder, quick fix, but something that can truly create change over time. And the study also looked at cost effectiveness, so a cost-effective solution to helping the obesity epidemic, which is certainly something that's at the top of our public health agenda in Australia.
I see. And since it's a fairly new research, I'm pretty sure there's a lot of misconceptions that goes around with it. Can you tell us what's the biggest misconception that you've heard so far with regards to the study?
Yeah, I guess in regards to the study, we've had, lots of positive responses around the globe to this news. Weight Watchers already have more than 80 clinical studies proving its efficacy. So, nobody was really surprised to see that our approach works. We're a company that's been around, our grandmas, might know about it. So, kind of 50-year-old brand, and one of the keys to success has always been that we are grounded in the latest weight management science. But I guess in terms of, misconceptions and things that keep me awake at night, is that people, still think that it's the fad diet or the quick fix that's actually the most interesting solution, and people are really attracted to, something that promises big results without needing to do very much. And I'm sure that every health professional that's listening will agree with me that's extremely frustrating.
Yeah.
And, overweight and obesity is a serious public health issue, and, we need to act responsibly in this space. Weight Watchers is the only commercially available weight management program that meets the strict criteria of the Weight Management Council. So, abide by a code of conduct for, safe weight loss, and, everything we do from a nutrition perspective is aligned with the government's Australian dietary guidelines. So I guess the misconception that, fad type diets are the solution is the thing that, drives me crazy, and I would love to, see more and more collaboration between health professionals and credible commercial organisations so that we can truly make a difference to the health of the nation.
What is the best advice that you can give to anyone listening right now on how to lose weight, or whoever wants to lose weight?
Yeah, well, what we've learned from this study and from many other studies is that even though, it can be quite simple to think about what you need to do, to lose weight, move more, eat less, eat more fruits and vegetables. What we've learned from this study is that when people try to go it alone, even under strict clinical trial conditions, there are poorer outcomes than if you're part of a community, and, if you're looking for a way that is proven to help, reduce your weight both in the short term and the long term, then we definitely have an approach that can help. And I would say for the health professionals listening, the point is that we want to be referring patients to programs that work, and we have the evidence that Weight Watchers works. So we would love to, talk to anyone that's interested in collaborating with us to identify how we can assist.
With regards to our listeners right now, what's the main takeaway message that you want to leave with them?
What this new study proves once again is that Weight Watchers is a highly effective weight management program, and it's certainly part of the solution to help tackle the high and rising levels of overweight and obesity in our country. And this study in particular really shows us there's an opportunity for health professionals and credible organisations such as Weight Watchers to work together to improve the health of everyday Australians.
I see. And for anyone interested in reaching out to Weight Watchers and finding out more on how to lose weight, what's the best way for them to reach out to you guys?
Yeah, so our customer care line number is 131917, or search Google for Weight Watchers Australia and you'll find all the information that you'd like.
Awesome. Well, that's all our questions for today, and thank you for your time.
Thanks so much, Henry.
And that was Dr. Michelle Celander from Weight Watchers International. We just finished talking about their new community-based weight program management and what it takes to lose weight. If you want to listen to more health-related interviews and learn about living a healthier and fitter lifestyle, you can also visit us on www.hpr.fm. We're available on SoundCloud and iTunes. I'm Henry Acosta, helping spread awareness and better health here for Health Professional Radio.